This is the Trivrtka Lekhya. Then Kalyanagulam, everybody knows. Then Avibhatti Churnam, Sarve Samasam Siddha, Chaudrena Gudgi Kuda, Avibhatti, that one. Without creating Vipat, no complication powder. That is Avibhatti Churnam. No Vipat, no complication. And again, some of the important thing like Shatavari Kshirapakam, very, very excellent. In many of the Western countries, since I have been speaking to many Western country people, it is very difficult to get many medicines there. But asparagus, many varieties of asparagus is available in that country, especially in the European countries. Many varieties of asparagus are available. So we strongly recommend people to take Shadavari Kshirapaka or Shadavari Chinnaruhadi. In the Ashtanga Shadavari Chinnaruhadi is there. Or the Tiktagam, Mahatiktagam Kashayam are also very good. Padawaladin Bagaduga, Darvi Pada, Duralava, Papadam Rayamanam, that, or the next yogam in the Kushtadilsa, or in the Padawaladiganam, in the Shodhanadigan Sagraham, also very, very effective. Then the Vyadhi Pratinigam. So Samani Chikitsa again, keep it in a mind. I mentioned in the last class, don't pick on to any disease, what is mentioned in the book, and follow rigidly into that. Then you may fail. Suppose if you are teaching Ayurvedic student in Ayurvedic class about thyroid, you may have to say, okay, you follow this prescription, you will be very successful. Okay, this is enough, because for a student, we should not create any uncertainty. They should feel things are certain. So we can say, but when you are sitting in the bedside, when you are sitting in the, we are explaining in the bedside, or when you are in the outpatient situations, things are very different. So we have to say that it is based on the avastha. According to the situations, according to the areas, different things can be used. So some cases it may be Kalyanagam Kritam, some it may be Panchagavya Kritam, some may be in Shadadauta Kritam. So like that, it all depends upon what type of medication you want to give, different situations. For example, you have very kapha association feeling is there. Definitely you try some Panchagavya Kritam, very, very good, excellent yoga. Then, as I mentioned yesterday, I mentioned that Hamsavatyadi Kashayam, Varanadi Kashayam, but there are medicines like Asanadiganam or Ashtavargam, Balasajare and Shundi Rasasudrama Yogam, which is very good to improve the Agni, which much improve or better to do Shodha Shodhana. Ashtavargo Anilabaha, very good. Kanjanara Gugulu, very good. Then try to understand the applications based on the dosha. If there is a pitta association is too much, some daha symptoms, shatavari, kshirabala, these type of things can be used. But whereas you find more kapha association is there, try Kalyana Ksharam, Galambad Sharam, there are different type of things. Again, be very, very careful when you use some external treatment on the head. If you happen to use different external medications, like Murtha Taila, I mentioned that you have to be very, very careful. Suppose if you are using in hypothyroidism, if you are using, for example, if you are using Tila Taila on the head, patient complains next day that, doctor, I have severe neck pain. I have some myofasciitis like things. So, Murtadailam is not very good in many of the hypothyroidism cases, because most of the time they have a amavastha, either in the costa or these type of shakha areas or peripheries. So try to give some amabhajana internally, plus you may able to give some dibana medicines here to reduce this, like even simple Dasnadi Churna application is enough for a few weeks, and then start oil will be better. Takradhara, Talabodichil, very, very good. Kshiradhara, Dhanyamladhara, excellent. Different lepa as a worth trying raw. Again, which I missed yesterday, is correct Dhatu Agni which is most important because that can only bring the hormonal equilibrium. There are excellent Rasayana Prayogas. Phaladaka, Leshuna, Pipali. When we are doing our post-graduation when I was doing my post-graduation in SDM Udupi, in 2000 we made a few cases about Lashuna and about Pipali. Pipali, don't underestimate these medicines, Lashuna, Pipali and all. Even it acute back pain, sciatica, only Lashuna, Rasayana, mild Virechana, Lashuna, Rasayana given, dramatically pain came down, even without doing any local application of any oil. So there are possibilities that it can go very deeper. Acute pain in the rheumatoid arthritis patient, tried Pipali, Vardhamana Pipali, only Pipali, Vardhamana Pipali, and pain drastically came down. It happens, it is possible. So similar way, strong Rasayana, if it is practiced in the correct way, it can also bring results in thyroid dysfunctions. Depends. We may try Ashwagandha, Uluchi, Shatavari, or even Amalaki. Definitely. Uluchi is again a very good drug of choice. Whenever we have a prameha, thyroid dysfunctions and all, Uluchi, Amalaki, Haridra, these type of combinations definitely brings very good result. There was a question yesterday related with correlations, Pandu, other things and all. As I mentioned you, I doesn't want to make any correlation at all. Hypothyroidism is hypothyroidism, hyperthyroidism, hyperthyroidism. If you want to say in a simple way of hypothyroidism, there is a Mandagni, hyperthyroidism, Atyagni. Okay, goiter, we may have some similarities with the description of Galaganda in the text. Galashopam descriptions, when you read, you may have some correlation with thyroiditis, not completely thyroiditis. It may be extended to other inflammatory process in the neck. Many times, many of our descriptions are not restricted to the thyroid gland. It may be also unidentified lymphadenopathies also there. Or if there is a thyroid nodule or adenoma, Gala Granthi or Gala Arbuda with malignancies, we can use these words. But truly speaking, I don't like to use these type of words. Naming an Ayurvedic, putting a name from Ayurveda makes no sense. It may be good to show somebody outside Ayurvedic community, but for us, it's not necessary. It's more than that. What we want to do, what we want to know is the details of the disease, what best treatment is prescribed. Suppose if you label a case this, and if you take treatment from that chapter, that medicine, it may not necessary that it should work. Rather, if you have a proper samprapti, if you have a clear idea, you may take medicine from any other chapter. It may be you borrow a formula from Vadavyati like a Guglu Tiktagam. If you borrow a yoga from Pushtajilsa like a Tiktagam. Suppose if you name a disease like Galaganda, Gandamala, these type of things, so immediately you rush into see what is described in that book. Like Vaishidhi Ratnavali have a lot of descriptions as things. So when you jump into the diagnosis into that, trying search for the formula, make the formula and give to the patient, but many times it fails. And more than that, it is much more simple if you try to understand very logically from Ayurvedic point of view. You start thinking from the Mahabhuta level. Start from thinking. Bhude Bhishya Param Nasti Chinta Chigilsiddhi. Sushruta says like that. So if there is a Mandagni present, you think, okay, there is a Prithvi and Jala Mahabhuta is increased. Agni went down. Tejas is went down. Vayu Akash is raised. So there is an increase of Kapha, Pitta went down, Vata effect. So what to do? Think about that. And then think about the Shroto Dushti, what is happening in the rest of Shroto Dushti, what making the Uttarottara Dhatu Dushtis. Then think about different type of how this Koshta-related Agnimandya is referring to Ama, Shododushti and Bhuta Agnimandya and the manifesting a disease. That's all. This is applicable for many of the diseases. Now, keeping on these things, you start thinking about Chikitsa, not quick fix to anything. Okay, if that is the case, so we have to do some Ruksha Sweta, Udvartana. Or it may be we have to do some Deepanam, Bhajanam, Brahmanam, Agni, Samrakshanam at least. We have to ask the patient to have a complete change of the lifestyle, do pranayama every day, make the Agni better, keep the mind very stronger. If you have the other side, if there is an Atyagni is there, then think the other side. There is an increase of Vayu, Mahabhuta and Agni Mahabhuta, decrease of Prithvi and Jala. Akasha is also affected. So Vata Pitta dominant, Kapha Manda. So in that way, imagine there is an Atyagni, there is a Doshapaka happening, then Dhatupaka is happening. So Aharam Agnim Pajati, Doshan Aharan Pajati, Dhadun Shinan Dosheshu Jividam Dhadukshaya. So permanently things are happening, as I mentioned before. So that way, conventional modern science recommends surgery, drug therapy, radio and therapy, one side. But if you try our own way, say Habana, Murtataila, medicines, lifestyle changes, it is possible. So it is not miraculous things. They have to go for a swastha paripalanam, keeping their healthy very well, or Vyadik Shamattu, keeping their Agni very well. They have to have Agni paripalanam with Dinacharya and Ritucharya. Some recommendations every day. Importance of pranayama yoga can give good result. Some Deva Bhashtaya, Yukti Bhashtaya, Sattva also can be taken into consideration. Chopam, Galagandam, Arbudam, Grandhi, whatever. All the Aushadha Chikitsa, Chara Chikitsa, Agni Chikitsa, we can try. So what I want to say is that we need not to restrict into Kaya Chikitsa. It may be a Shalaki Chikitsaka, Shalya Chikitsaka, even Yogacharya can treat thyroid disorders. Don't worry about the name of the disease, but look into the condition from Bhuta level to the Dosha level, to the Dosha level, to the higher level, and go on, keep going, so that we'll reach into a point that we know clearly the case is. Let me tell you practically, whenever I personally practicing, in the first visit, maybe we will not be able to reach into the expected level at all. We may not. In one case, if it comes first time, it takes a preliminary assessment only. We have to continuously ask the patient to know the patient detail, not only physical, mental, behavioral, emotional, even spiritual dimensions. Then only it will help for a complete change in their lifestyle, which is directly related with Agni, which in turn directly with thyroid. So there is no shortcuts in the thyroid management. It takes a long time to treat in many of the cases, but many of the cases may get well controlled in the first 6 months itself. But just like a diabetes, people wrongly thought that thyroid, once it manifests, it is forever, and there is no much medications. They have to keep on consuming this thyroxine or a neomarcosol or many other drugs, and there is no escape from this HRT, human hormone replacement therapy. But it's not true. If sincere effort happens from the patient side, a deep approach from a clinician side coincides together, definitely there is a possibility that the patient become much, much better than before. Patient can improve the quality of life. Even at least they could reduce a certain amount of hormone dosage in the next few weeks. and moreover, he can be more productive in the society. That is not a small thing, because most of the thyroid patients, biggest challenge they have will be the poor productivity in their life. If it is a hypothyroidism, they have another set of problem with poor productivity. In the hyperthyroidism, they become almost like antisocial. They become very arrogant. They demand things to happen. Again, it is useless in a good, healthy environment. So that is the thing. So at this point, I will stop here, and I believe there may be a lot of questions at this moment. Let me hear the questions, and then if not, then we'll discuss some of the important points again if there is anything to be elaborated.
Thank you so much, sir. It was a wonderful session. Thank you for sharing such great experiences with us. It was really an eye opener to, I hope, to all the attendees attending this session. Thank you so much, sir. And about this, one of the doubts which I personally have is, sir, you told about a condition, the first it will be a hypothyroidic patient, and maybe because of the not proper treatment of hypothyroidism, the person may be showing a hyperthyroidic features, or maybe it turns out to be a hyperthyroidic condition. So in such cases, what are the symptoms that we can expect? Because most of the times we won't be like checking the thyroid levels always. So we'll have to really, as an Ayurvedic physician, we'll always have to rely upon the symptoms that the patient is showing, because only through those symptoms that we can come to our own lines of treatment, because we always treat in the basis of doshas. So for that, what will be the symptoms that those patients would be showing? As per your experience, have you come across such cases? If so, what are the symptoms that those patients would be showing?
Generally, when somebody start taking hypothyroidism, manifest hypothyroidism and start medication, it is not common that they get hyperthyroidism, because if they consulted a good endocrinologist, he will have his own method of prescribing thyroid medicine protocol. Generally depends upon the levels of the TSH. He may start with 25 mcg or 50 mcg, whatever the dose. He will ask the patient to come for after 3 weeks, 3 months and check again. And generally he will fix a specific dosage. If it is an adult person, specific dosage. And generally he expects things will go in the same dosage. Things will go in the same thing. But it's not uncommon also that sometimes the dosage what they prescribed may not be sufficient in the body, and the person will again complaining of the most of the same symptoms what they have, like hair loss or severe fatigueness, lack of interest, many symptoms. And the doctor, what they do is that there is a traditional endocrinological practice is to increase the dose in the Saturday and Sunday. Actually, it comes from the typical Western British Thyroid Association, because in the Europe, and in the United States, people have 5-day week, and Saturday and Sunday they have a lot of work in the house. Normally women will work a lot in the house, Of course, other day they will be in the office, not having much physical activity. Many of the time, many of the people. So Saturday, Sunday, there will be change of demand is needed. They decided. So some endocrinologists, very traditional endocrinologists, I don't mean the young people, they prescribe, for example, 50 Monday to Friday and Saturday, Sunday, 75. But in India, sometimes the reverse thing happens. Saturday and Sunday, many times their family are relaxing and they may be having more pleasureful time, less work and other things. What happens that instead of excessive work, they have less work, or maybe different reasons. This will keep on disturbing their system, and there is a decline of TSH from 0.4, normally lies between 0.3 to 0.4, or in 0.5 to 5, or 0.4 to 4. The different school of thought is there. So it comes down to that. If that is the case, they will start initially, they don't show any symptom. So that is a challenge. So this can be called as a subclinical hyperthyroidism. Okay. But after some time, they will start complaining that they have a dryness of the skin. All of a sudden, they start identifying dryness of the skin. They will have a vaginal dryness. They also feel some oral dryness. And they start complaining that unexpected palpitation. They're sitting alone, but they start feeling that heart is beating quite louder, which normally they doesn't hear. And feeling losing weight. But that will not be their major concern, because they may be expecting some weight loss in day-to-day life and it's happening good. But the symptoms like this type of, also the menstrual cycle becomes slightly scanty. But most of the time, these symptoms mimicking some of the symptoms related to menopause too. So many times they don't get really medical attention. In reality, which they could come to and meet the doctor, they don't come. But if you are a very keen practitioner, sometimes the husband comes for some treatment, and the woman who is on thyroid medications, if they sit aside, by looking at their face itself, you have idea about the thyroid gland status. But it takes a long time of experience. But if you look at the face, you can ask them, are you taking thyroid medicines? Yes. What is the dose you're taking? Because just like, that if you look at a person's face, and if you ask the person to go for a day sleep for 2 hours, then ask them to come back and look at their face. I'm very sure all of you can say, looking at the persons and says that, did you slept sometime now? Because there is a typical puffiness, a transient sort of water retention on the skin, just below the skin, which may disappear after some time. Similar way, there is a very peculiar things can be seen in their face when there is a change in the hormone. But obviously, it's not very easy. We have seen hundreds of cases regularly. But it is possible. And again, another thing is that how they communicate their over-enthusiasm or explosive expressions. This is all typical of change in the thyroid hormone. Okay, Gauri, doctor?
Thank you so much, sir. Thank you. Sir, there is one question one of the attendees have asked. It is like it is Dr. Shweta. She has a patient with Pandu, Taulia and high blood pressure, and she has given a Viragina. And now it's like she's asking how she should be managing the patient.
Okay. If you have a patient with a Pandu, Taulia, high blood pressure, you made a very good choice that you've given a Virechana. But after Virechana, since these three things are associated with Vata and Kapha associations in general, try to give some medications that which can support Vata Kapha and also improving Agni. So you after a Virechana, you can start some Rasayana medicines like Dashamula Haritiki. For example, in Kerala practice, we use Dashamula Haritiki. Very good medicines for all these conditions. Or you can start with the medicines like a Drakshadi Leham. There is a yoga called Draksha. Simple Draksha and Pippali is there. Only two medicines are there. Draksha Prastham, Kana Prastham. In the Kasa Chikitsa Yogam is there. Only Draksha and Kana is there. Or also similar prescription, you get another yogam called Murdigadika Lehim. Available in the market, Kottakkal and almost all the pharmacy have. Murdig Arthabalam, Trimshet Pipilim, Ehayat Mathuna. Again, Murdiga, that is the Draksha and the Pipili in a different proportion combination will be very good. Since you have made a Virechana, don't start giving again these medicines, Kashaya, Churna, that thing. Try to give some medicines because you already made a channel, Shrotas are very, very clean. Now you have to give medicine that should act as a rasayana. Will be very, very important. And since there is a high blood pressure, better try to give medicine that have anulomana nature, not grahi or stambhana in nature. I think that is clear.
Thank you so much, sir. And Dr. Shweta Sharma, I think it is clear. And if there is anything else you want to discuss it with Dr. Nambi, sir, you could directly ask by unmuting. Hello, Dr. Shweta Sharma. I think she's fine, sir.
Hello? Hello?
Yeah, she's
Sir,
there.
can you hear me?
You can.
Sir, but I wanted to communicate that the Virechan was not satisfactory. Like she had only 10 Vegas. So is it sufficient or should I repeat the Virechan?
No, 10 Vega is fine. Fine, doctor. I think that is fine because when you have a Pandu and Staulya, don't give too much of Virechana. But 10 is fine. You start with Rasayana.
And sir, she is taking 150 mcg of thyroxine.
Oh, okay. No problem. If you have made a Virechana, then you can start either Dadimadi Kridam, but which medicine you have made a Snehapana or you made a directly Virechana?
No, sir, Snehapana with Triflagrit.
Okay, very good. Then you can start with the Dadimadi Krida. If you are planning for reducing the TSH level, you can start Dadimadi Krida like a Rasayana dose. Ask them to take Dadimadi Krida. Initially, you start with 5 grams every day night after food. Then you may slightly increase the dose into 5 to 10 or even 15. You give it for 1 month, then you check it again, the T3, T4, TSH. Or at least free T4. Definitely you will get a very good result.
Sir, can we accompany this with the Triflac with honey added to it? Sharangadal has got a reference for reducing stolya.
Yeah, you can. There is no problem.
Okay. Thank you, sir.
Thank you so much, sir.
Go to the yogam from the granthas. Okay, granthas are really fine. When you become a very good practitioner, you can take yogam from the granthas. But meantime, try to logically take the advantage from the granthas.
Thank you so much, sir. I think we have another question. Okay, sir. Can we move on to the next question, sir?
Sure.
Okay. So there is one question asked by Dr. Trisha. It's like, sir, generally we get lethargy, low energy, etc. as symptoms. I think to hypothyroidism. And Karjuradi Manta or Mritvika, if we suggest a patient feels that their sugar will fluctuate. So what can be the choice to increase their energy?
Actually, this lack of energy is happening. Two reasons. One is due to the Agnimandya in the costa, and second one is due to the cellular resistance in the periphery. So if you want to increase the costa, instead of giving Kharjura Manda or Mardivika, you try to give some Deepana Bhajana, simple Panchakola Jala, Trikatu Jala, like that. That is enough for improving or getting the energy. Like if you give a ginger coffee, is fine. A coffee with a ginger could be a good thing. Tulasi or ginger you give could be a good thing. But if this lethargy is repeatedly happening, there may be possibility of cellular resistance. That means we have Dhatu Mandya in the Shakha. Then we are, for such situation, this Karjuradi Manda Mardviga is not enough. We have to make mild Virechana. You just give Avipatigara Churna with a honey, or if with a hot water, give it. That can bring results.
Thank you so much, sir. We have another question. So, what should we give more importance to during treatment, to the doshas or dadus? Is there any specific sequence for treatment of thyroid disorders as to which to give more priority?
Actually, it's not that you should know more about dosha or more about dhatu. The basic thing is that maximum number of symptoms we get, it gives a better picture, a better possibility for deeper understanding pathology. It's like you are making a painting. If you have more number of colors with you, you have larger freedom to make combinations by your own. So your canvas can be much more beautiful. Similar way, if you keep on asking the questions or patient keep on telling the symptoms, it is good to know more and more so that we categorize these symptoms based on different dosha, and we try to analyze how these doshas are disturbing the dhatus in a deeper level, so that depends upon that symptom which may we could able to arrive into the best treatment possible in a given situation. So it is as equal, dosha or dhatu, both are very equal, equally powerful in decision making. But while we planning the treatment, even beyond this dosha and dhatu, the Abhyantara Vigriti Parambara also very important. Are you planning for Shamana, Shodhana, Brahmana, Rukshana, Langana? What type of procedure you are intervening to? This is quite significant. Beside all these things, suppose if you have a hyperthyroidism and you want to give some medications, but keep it in mind that there is a Pitta Vata Vritti is there. So the medication should not increase Vata or Pitta at all. But if you fail this, you have a problem. So like that, if you know the specificity of the dhatu, it will be very useful. But we cannot exactly say that which is more important, because both are important while planning this. So you have to make the combinations of things. As I mentioned in the last presentation, when apakwa kapha enter into Rasadhatu, Rasadhatu basically is a real reservoir or ashray of kapadosha as an ashraya. But that ashraya is there when the doshas are in its own characteristics and dhadus are in its own characteristics. But if the same dosha become mala surupa or non-utilizable form or in a wrong gunas enter into Rasa Dhatu, we have a large number of problems. Charaka says, Ashadha, Ariji, Chasya, Verisya, Marisachanda, Ahala, so Gaurav, dash, as Rasa Pradosha Javikara. It includes Kapha associated, Pitta associated, Vata associated too. So identifying in that will be very useful. For example, if you have only Rasa Dhatus involved, you don't need to do much of the procedure. Maybe a simple procedure which correct the Rasa is enough. That's the purpose. There is no shortcut. In reality, there is no shortcut in treatment. It is not as easy like prescribing levothyroxine or altroxine. That is the truth. In modern medical science, practicing is very, very simple because there is no responsibility. There is a protocol. You are an intermediate person. You just follow the protocol. Make a diagnosis. That there is a challenge is there in olden time. Nowadays, that is also no challenge. You take the prescriptions, you take the investigations, so find some diagnosis. Just follow the book of the CMDT, Current Medical Diagnosis and Treatment 2020 or 2021. You follow this prescription. That's all. There is no logic, there is no creativity in a general GP practice. Of course, when you are a very advanced endocrinologist, you have, but in general. Similar way, but it's not as similar way in Ayurveda. Ayurveda, if you want to practice very seriously, you have large number of criteria, you have large number of set of things or frameworks to be adopted. That is why practicing Ayurveda is very, very difficult. Practicing modern medicine is very simple.
Thank you so much, sir. Now, there is one more question which has come up. Sir, it was asked by Dr. Kartika. As a beginner in thyroid cases, for an asymptomatic hypothyroidic patients with TSH less than 25 who haven't taken any of the allopathic medicines, what all should we consider and what all can be our drugs of choice for such a case?
Okay, so it's a fresh case, less than 20 TSH level. First thing, you have to exclude the possibility of physiological alteration of TSH. One. Once you excluded, then you come up with a diagnosis as subclinical hypothyroidism. Fine. At this stage, this patient doesn't need any modern medication, including thyroxine. First thing you have to do is first 1 week, start giving medicines or ask the patient to use Agni Deepana. You can ask the patient to take some Agni Tundi Vadi or Chitragadi Vadi or what you get medicines in the market which can increase Agni. And some of the symptoms will disappear. Then slowly, if she feels better, slowly start with, of course, very, very strict diet restrictions. No day sleep, no milk products, like that. You advise strong recommendation without much medications. Maybe simple medicines like this. Then, after 4 or 5 weeks, you check it again TSH level. And if that TSH level comes down from 20 to 10 or 20 to 15, patient will be happy, ask the patient to continue. If doesn't come out the expected level, start Dadimadikradam. Then ask them also to stimulate the Agni by doing yoga, doing exercise. Just like walking, you may do some regular walking, slow progressive walking, some fitness programs, focusing on overall metabolic activity, not cardio exercise, not necessary to have a cardio exercise. More than that, physical muscle utilizing exercise, not the cardio or running like that. You do those type of things and check it again after the 6 weeks. Definitely, there will be a decline of thyroid gland. I mean TSH. At least it may reach to 10. If it doesn't reach to 10, then you start some prescriptions like a Kanjana Ragugulu or some Kashayam if needed, Varanadi Kashayam if needed. If TSH is 20 and old, you don't need to make Varanadi Kashayam to be in reality, really. The other things may be enough and it can bring better. Okay?
Hello.
Yeah.
Thank you, sir. Sir, we have one more question. Is there any specific exercises that we can give during these hypothyroid cases as well as hyperthyroid cases?
Hypothyroidism exercise are not good. Rather, if they follow meditation, mindful meditations are very good. Mindful meditation is a very common meditation which you see in the internet and all, you can see it. Don't do any pranayama or any hyperventilatory pranayamas like Sudarsana Kriya, these type of things in hyperthyroidism. It's not very good. But in hypothyroidism, definitely yoga, pranayama have a great role, especially regular Surya Namaskar itself can do wonderful in improving the metabolism. Vajrasanam, Sukti Vajrasanam, and there are some of the yogasanas, like even the Shirshasanas, are found very effective from the studies of S. Vyasa. Exercise, as I mentioned before, exercise are good, but in hyperthyroidism, not necessarily to be done, but in hypo, instead of cardio exercises, more on muscle-dominated, musculoskeletal, especially muscle-dominated exercises are good. I strongly recommend always to go for a simple walk for 3 kilometers in